Our afternoon discussion on the film Mama. What particular character or what particular behavior identified? Uh, Give me where you would like to start.
So I'll talk about the two little girls. Um, the one thing that I was mentioned and I was thinking about was like a dissociative identity disorder because the patients were talking to a different character, and this character we didn't know was real, and so we think that this could have been them creating this own character within their minds.
Yep. And do we know the ages of these girls?
They were 5 and 8, I think.
So
or 6 and 8.
6 and 8. Okay. So older sister is 8. Um, if they come to clinical attention, I think you heard me talk about this before. Always try to start out with the behavior that's been identified as perhaps being normal or age appropriate until proven otherwise. So, what else might be in our differential diagnosis upon either of these two children presenting to clinical practice? Who is going to make the counterpoint that this is normal behavior?
Yeah, I guess you could make the argument that like a lot of young children have imaginary friends or maybe characters that they can create and even like talk to and interact with. So I think up to a certain age, I'm not sure what that age is. I think it's actually developmentally appropriate for them to have these friends.
Right. So I think that's where we start, right? So why isn't Mama a simple imaginary friend of two girls who are abandoned in a cabin in the woods and need to cope? I mean, they're without any parental figures, so it would make sense that their imaginary friend might be named Mama, right? So a couple of things here. One, quantitative. Are they outside of that age range where we would consider this to be culturally sanctioned behavior? And B, even if so, is there something going on that would concern us, something qualitatively that we think should come under the um, supervision or assessment of a psychiatrist? So, any thoughts about that?
Sorry, I'm not sure the exact number.
So, yeah, this is where we get to developmental milestones, and unfortunately, we do not have a child adolescent psychiatrist here. So let's focus on that other part, the second part, with regard to the qualitative aspect of the behavior. I do think that the older sister at age 8 is a little bit beyond that quote unquote upper limit of normal, where we would expect an imaginary friend. Having said that, the younger sister, certainly at the age at which she's abandoned, definitely yes. But even beyond that, there's a qualitative aspect to this that might concern us. Anyone? Imaginary friends should not really govern the child's behavior and certainly should not induce behavior that itself would be considered abnormal. And I'm concerned here that that is in fact the case. So I do agree with you. There's some pathology here, but I want to make sure we get to that discussion by first kind of discussing through the idea that this might be normal age appropriate behavior, which it appears that it is not. All right. So, what else have we observed in these children? And again, with all due respect to the company here, there is an absence of a child adolescent psychiatrist among us. But otherwise, what did you see? What else should we discuss with regard to these kids?
Like the way that they were talking about Mama, like they would say um, when like the mom figure that like they actually had in real life. I'm sorry, the names. Um, like when she was interacting with the kids, like they would say Mama would get jealous, like if you did this, so like go away, like and things like that. And I feel like that's just not appropriate if it's an imaginary friend, since they're giving this like Mama figure like a really big personality, like characteristics of them that would be necessary in a person or in a imaginary friend.
I mean, somewhat commonly, a child might reattribute their own impulse to the imaginary friend so that they can actually communicate, for instance, to a parent and have it pass the superego sniff test, referred to as the reality principle. So when the imaginary friend says, or when the child says, my imaginary friend is mad at you, that's the child's way of expressing anger, because to do so directly towards the parent would be culturally inappropriate as per that child's superego. So when we hear both of these children expressing things through mama, mama says go away, mama's angry, what I think the clinician and psychiatrist would consider is that the children are angry. Again, the idea here would be that we have to find some kind of resolution with regard to watching this film through the lens of a psychiatrist versus just enjoying it as a supernatural horror film. But from a clinician perspective, these kids are obviously conflicted, right? They certainly have some issues that require clinical attention. What else do they do other than the fact that they're very angry?
How common is it for children or siblings to have a shared imaginary friend? Where they're both perceiving their existence?
Uncommon. I can't give you a point incidence to that. It's uncommon. Yeah. So that's a little bit of a concern. What might go a way towards explaining this? Yeah, I mean, if an older sister has an imaginary friend, in this case, the younger sister might begin to attribute some of that to her own experience as well. That can happen. And we saw that with the Slender Man case out in Wisconsin. It's probably an element of that as well. The difficulty here, though, is that usually, again, this is textbook, not necessarily always applicable to real life or real fictional life as it is in Mama. Usually, the index case is number one, someone of authority or some other higher standing, older sister, and is more severe. In the case that begins to incorporate the delusional aspect, the individual is usually of a subordinate nature, younger sister, and the illness is less severe. But that's not the case here. It just looks to be seems to be less severe in the older sister. Right? So it's not really consistent with the textbook or the medical literature.
So at what age is there a specific cutoff for like children with imaginary friends where you become more concerned for something like, maybe like schizosis or like schizophrenia? Because I presume like that's an important like maybe line to draw where like, because of these, adolescent schizophrenics who are diagnosed, that we all know has a potentially be more severe form of schizophrenia. So, I mean, is there any way to kind of like, is there an age limit? Is there a specific?
No, there's really no. I mean, you'll see this published sometimes as milestones, certainly, but there really is no hard and fast limit. I'm thinking around 5 to 7 would be a time range. But of course, if there is stress in the home, we're looking more towards 7, 8. If the home is stress-free, we're dealing more with 4 or 5 in terms of the imaginary friend. I mean, imaginary friends are very common, 2, 3, when the individual might have a tea party, etc., because of the trauma that comes from individuating from parents' dependency. Right? So they're totally dependent upon the parent, and during their terrible twos, they will begin to push that ticket. And it's bittersweet for the child. They're trying to gain independence, but they yearn for that dependency. So it's a transitional period. And there are things that the child can do to cope to get through the stress of that transitional period. Defense mechanisms include fantasy, which would then result in an imaginary friend. Maybe we'll call her mama. But another might be animism, right? Defense mechanism of animism. When the child may impart human qualities to inanimate objects, and that's the teddy bear. Not seen in this movie. I'm wondering if there was a teddy bear in that cabin, whether Mama would have ever existed. Right? Right. Because maybe animism would have been the easier thing to do, or at least subconsciously. It would make more sense subconsciously. Again, that's normal with regard to that transitional period where the child strives for independence, but of course is conflicted. Once they get through that, there might be further trauma, and that's where we talk about neglect and abuse. And if present, it could certainly push that upper limit of normal, that age threshold higher and older. Right? And of course, I mean, you look at the trauma that these two young girls endured of surviving in that cabin alone for years, and I would certainly think that Mama, as an imaginary friend, would be consistent even at that older daughter's age. The younger daughter's Lily, right? Yeah. The older daughter is Victoria. All right, I always forget Victoria's name. So I'm sorry I couldn't answer your question, but certainly I really don't think there's a real fixed age where before it would be normal and after it would be abnormal. So I'm not sure that really works. What other behaviors are we looking at here with these girls? This really gets to attachment, right? These are the early experience and attachment theory with regard to Harlow and Bandora. And these girls had that attachment period disrupted in a major way, right? Murder-suicide, right? And then having to live alone. Other thoughts about that? How did they survive?
That would have been my first question.
Yeah, I mean, again, if we're doing this and we're on call and I'm getting, this sign out again, and hopefully a child adolescent psychiatrist would be on call with you, but I don't want my medical student on call at 3:00 in the morning about a new case that they just evaluated and now need supervision on to tell me that it's okay because they were reared by a ghost, right? And I'm not sure your clerkship grade's going to pan out for us. So, I mean, I think, especially when we look at Victoria, she probably had to resort to do some things that no child would ever have to consider doing. And we see this, generally speaking, with episodes or cases of trauma where the child has to grow up. And especially with regard to siblings, one has to become the caretaker and they lose their childhood. And that's exactly what happens to Victoria here. Right? She does not have a childhood, not only because she has to find a means to survive, but she has to take care of her little sister who herself is traumatized. And, this is real. Of course, when it comes to issues pertaining to abuse and neglect outside of the fictional movie. Does Victoria demonstrate any further signs of precocious behavior? Because that's what we would be concerned about here, right? I mean, part of her being reassimilated would be trying to get her to, quote unquote, be a child and enjoy the things that a child of her age should be enjoying. But that's, of course, no easy task, and we would not be surprised if she demonstrated precocious behavior, even if she was sexually inappropriate for her age. Although, again, in this case, in that cabin, sexual trauma was not likely to have occurred. Right? Again, this is where you nerd out and watch the movie again with that specific focus to see if in fact that happens and if there's any evidence of that.
I mean, I guess there was one scene where Victoria was trying to cook breakfast for the family, and so I mean, it could be like normal for 8-year-olds to cook breakfast, but I mean, she was trying to cook it. I mean, because she probably did it for all those years for her baby sister. So that's one thing I was thinking of.
Yeah, could be. Yep. Anything else with regard to these kids? Any other characters we want to discuss today?
I guess you could discuss the character of Mama as well, because I guess she herself was raising them and kind of like hurt people who passed away. So I guess she herself had some like pathology going on.
What if Mama wasn't a ghost? What if there are two characters named Mama in this movie? Mama in the Woods, who happens to be someone who might be afflicted with a schizoid personality disorder, who prefers the life of being socially detached, and came upon these kids and made a decision to not return them, but instead care for them. Of course, once discovered, there's something else going on, maybe an imaginary friend separating from that nurturer who remained in the woods, and creating an imaginary friend so that they didn't have to say goodbye to her.
I think that sounds likely, given the fact that I find it unlikely that these two girls could have survived out in the woods completely on their own. So maybe they did have some sort of assistance from another person who then continued in their figment.
Write that narrative. What's this woman doing in the woods? And did she say anything to these kids that might result in them using the terminology ghost when describing her continued presence? Remember, the transitional object, the blanket, the teddy bear, is so that the child can actually have a surrogate for the maternal caregiver or paternal in their absence. Mom leaves the room, dad goes to work, you cling to that blanket, right? In this case, we're not talking about animism, we're talking about fantasy as a defense, resulting in the imaginary friend, right? This autistic retreat into a make-believe world where a ghost exists. Might this be a way of the girls self-soothing and separating from their maternal figure, not the individual who was murdered at the beginning of the movie, but the maternal figure who decided to stay in the woods as these girls were discovered?
I didn't think of that by my own, but that seems entirely plausible.
So again, to nerd out here, does anybody happen to recall? I know that there's the one scene in which the father is ready to kill his daughters, and he's stopped. It's a very quick scene. Whether we interpret that as a ghost or a figure slash real life person could be a subject of debate. After that scene, following that scene, do we see Mama in the woods at all again? Because if the answer is no, why wouldn't she be humanoid and otherwise a real person?
Does Victoria's vision have anything to do with it? If she does her glasses, she probably needed corrective lenses and didn't have clear vision for the entire time that she and her sister were abandoned, or not abandoned, but lost. Could that the poor development of vision lead to potential visual hallucinations that she could have seen and interpreted as a figure?
Yeah, I'm not even sure I would go so far as to say visual hallucinations. I think number one, when we actually look at that scene captured where Mama stops the murder, that might be seen through Victoria's eyes, and that's why we see this as a ghost-like, amorphous figure, rather than a formed individual, a woman. And then similarly, if this woman is caring for them in the woods, the way that Victoria has interacted with her without glasses might actually affect the way her imaginary friend is then experienced once she has returned to her uncle's home. Right. So yeah, that could definitely have an effect. So I'm not even sure it's a true visual hallucination. I just think it's a misperception. Otherwise referred to as an illusion. So let's actually piggyback this and quickly segue to your shelf exam. When we talk about positive symptoms of schizophrenia, and somebody mentioned childhood schizophrenia as a differential diagnosis here. So when we talk about schizophrenia, we look at different symptoms, including delusions, hallucinations, grossly disorganized or catatonic behavior, disorganized thought process or speech, and then negative symptoms. So 5 total. there are 4 positive symptoms, and there's one criterion for negative symptoms, any one of which rules in. Negative symptoms are thought of as the pathological absence of something that at baseline should be there. And they are often referred to as the 5 A's. Unfortunately, it's sometimes difficult to remember those 5 clinical terms. If we go by the second initial, it spells out the word plant, including apathy, right? The absence of motivation, right? Or otherwise, number 2 would be alogia, absence of speech. The third letter actually goes by the A, right? That's affective flattening. The N is anhedonia, right? Absence of interest. And then the final one is attention deficit, right? Obviously the absence of normal attention. So it's the pathological absence of something that at baseline should be there. And that results from lowered dopamine levels, perhaps due to schizophrenia, or any multitude of causes. Usually at the level of the mesocortical pathway, if you're asked. Conversely, positive symptoms of schizophrenia or positive symptoms of psychosis are the pathological presence of something that at baseline shouldn't be there. Hallucinations, delusions, disorganized behavior, disorganized speech or thought process. Right. 4 examples of positive symptoms. This is excess dopamine at the level of the mesolimbic tract. Right. Now, interestingly, because I'm not really ready to label these children as having childhood schizophrenia, it's extremely rare. And it sounds like we have a working differential of something that makes more sense. But interestingly, if the dopamine dysregulation of the central nervous system is pervasive, a short track, so those are 2 long tracks of dopamine synthesis, but a short track can also be implicated. And that's the short track in the retina. And it's thought that dopamine dysregulation there results in visual hallucinations. So I hope this is due to her misperception and not due to a visual hallucination caused by dopamine dysregulation at that short retinal tract. When you look at these positive symptoms, we look at one called the hallucination, and we want to differentiate it from the illusion, that's with an I. What differentiates the visual hallucination from the illusion? And now we're focusing, pardon the pun, on Victoria's behavior. How do we differentiate one from the other?
Hallucinations can occur without any stimulus, without any stimulus and illusions, as we described as like a figure had his experience and then misperceived.
Exactly right. Right. The visual illusion will be exactly that, a misperception of a real stimulus, like a hermit in the woods that raises a kid. And that differentiates from a visual hallucination in which the individual has a perceptual disturbance that is not induced or a misinterpretation of a real stimulus, which probably is not going on here. Talk to me about this character, Mama in the Woods. So you don't think that someone who finds 2 children in the woods and elects not to call the authorities, a person like that probably would not come to the attention of a psychiatrist? But they'll probably be reported to the law enforcement first, but at some point, I think even the police are going to get psychiatry involved, right? And what might be some expectation here, and preparing ourselves for this particular psychiatric evaluation of Mama.
Maybe they have like an now I'm getting my personality disorder.
That's why you're here.
Yeah, it's not the avoidant one. What's the other one? Schizoid, exactly. Maybe like a schizoid personality disorder where they just like really want to separate themselves from society, and that would explain why they were in the woods in the first place. And kind of when the children do get discovered, they have like an intense fear of like interacting with other like members of society, and that's why they didn't report the children or come with them.
So you mentioned the avoidant personality, which certainly has to be in our differential diagnosis. The avoidant personality, and we talked about this related to Seinfeld this morning, is the individual like George Costanza who will usually avoid social situations due to fear of rejection. And the idea is that if they don't put themselves out there, they won't be rejected, and therefore you'll be kept safe. They're free from rejection. That's their goal. That said, the individual with the avoidant personality is conflicted. They will come to clinical attention, albeit through chief complaints of anxiety and maybe even depression, because of their wanting to be out there, but they just feel socially inappropriate or socially inept. On the other hand, the schizoid is similar in that there is social isolation, but it's preferred. So there's no conflict, and therefore the individual with schizoid personality is not likely to come to clinical attention, at least not as a self-referral. So it's a little bit of a red flag on your shelf exam. Individuals with the schizoid personality are usually referred to care by a third party, a Board of Health, for example, and are not self-referred. So that's just a clue on how to differentiate on standardized exams. So we're thinking here, maybe this is someone with preferred, which is interesting because when an individual has schizoid personality, part of the defense mechanism that is thought to play a central role in this happens to be fantasy, happens to be the same defense that results in the imaginary friend, albeit when age appropriate. So when you're 2 or 3 and you're having a tea party and a future one of you walks in your daughter or son's room and hears them talking to somebody and serving tea to someone and sipping tea with someone who's not there, don't call me. It's completely normal, right? I mean, if it's not affecting their behavior in some maladaptive way, it is completely normal 99.99% of the time. On the other hand, when you apply what you visualize now in your 3-year-old son or daughter and apply it to a 33-year-old, you should be a little concerned. That is outside of that age range. And if it is the case, and if it is clinically significant and part of a larger disorder, the most likely disorder that it will be part of is called the schizoid personality. So we have this maladaptive fantasy of these young girls that perhaps is due to their being reared by someone who is in the woods, who herself is afflicted with a personality disorder caused by that very same defense mechanism called fantasy, schizoid personality, which again might actually defend or at least explain why she didn't bring them to the authorities, right? So think about this. What if her personality disorder was exacerbated by something that happened with the authorities, resulting or directly implicating why she didn't bring these kids back the way any one of us would have, right? Can somebody? Well, actually, I don't want to derail quite like that. What I'm going to do is I got to figure out how to do this. There's another teaching point to be made. Let me figure out how to pose this first. Can you give me an example of something that may have happened to her prior to her retreating into the woods that may have resulted in her having this problem with authority?
She ran away from home. She ran away from home when her bad family situation.
So yeah, and boy, what a parallel that would be then in terms of what these 2 little girls are in for, right? So she maybe ran away from home, and herself, I mean, has been in the woods ever since that time. And given her past traumatic experience, that can certainly have influenced her decision not to return these girls, right? Any other thoughts about this film?
I guess it could, like Mama in like the 1800s, like the real woman who was based off of Edith, I think her name was. So like she said she like jumped off the cliff with her baby, like that seemed, I imagine was probably just born. Maybe there's also like some sort of postpartum psychosis that occurred with her. Maybe she thought that this was the best thing for her and her baby, so that's why she did it.
Yeah, absolutely. So, and that's, I think, the big reveal at the end of this movie is the actual case history of the fictional character Mama. And I'm forgetting the patient's name right now, Edith. Um, and she is actually, and I'm not sure if this was intended or not, but she is actually a fictionalized reinvention of a real case that occurred at the Trans-Allegheny Asylum in West Virginia with regard to an urban legend of a mentally ill individual who, while hospitalized, gave birth to a baby and was forced to give that baby up. And again, that's the clinical side. The non-clinical side is that then her ghost haunts that facility um, till today, right? So I don't know if it was just by sheer coincidence that this film that is actually set in Virginia, it runs such a close parallel to that Trans-Allegheny Asylum that is in West Virginia. I mean, and I would also think that at the time, well, maybe not. I was gonna say at the time it happened, maybe West Virginia was still part of Virginia, but it wasn't. It didn't secede yet. All right, so that's the big reveal. That there, and if you listen to, is it If These Walls Can Talk or If Walls Can Talk? Right, I think it's episode 60 of the Lore podcast. It gives you a very interesting, perhaps, background on the movie Mama, of all things, right? Revealing that this may be all about postpartum psychosis, right? Previously discussed. We won't rehash that as well. Again, if you go to my post on Psychology Today on Rosemary's Baby, I do believe there's a table up there that allows you to review postpartum blues, peripartum depression, and postpartum psychosis. If it's not, let me know. We'll make sure it gets posted on Instagram for you today. Any other thoughts about Mama in closing? All right, we'll end it here. Thank everybody, and we'll set things up. What time do we have? 1:15. We'll say at 1:30. We'll have our case presentations. All right, so relax, stretch, and we'll be back at 1:30 for those of you who have the link.